أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss a little bit about viral respiratory problem of equines. Equines includes horses, donkeys, mules, etc. So most of the horses owner and trainers they experience clinical respiratory disease in their horses every year and they refer it as simple cough. Actually, this is not simple cough. This may be due to viral infection. A more subtle poor performance syndrome is also recognized when horses of known ability perform below par and are referred to as having the virus. It means that when horses they perform below than the normal performance, they may suffer from this viral disease. However, multiple infections of equine herpes virus, rhinovirus 1, rhinovirus 2, picornavirus, and adenovirus may have been recognized, and such mixed infection may be more important. Horses may suffer from viral infection, and these viruses include number 1 equine herpes virus, number 2 rhinovirus 1, and number 3 rhinovirus 2, number 4 picornavirus infection, number 5 adenovirus infection. These viruses are very important. These viruses cause respiratory problem in the horses. Equine influenza, probably one of the most significant agent of respiratory disease in horses, occur in epizootics and involves myxovirus group of the viruses. The following viral subtypes have been recorded in infection. Number 1 myxovirus infection A, equi 1 myxovirus infection A, equi 2. Both affect the upper and lower respiratory tract of the viruses. And in among these two, myxovirus infection 2, myxovirus infection A equi 2 is more prevalent and causing more severe clinical signs in the horses. And we can say that more recently A equi 2 Sussex and A equi 2 Suffolk virus strains have been isolated. The latter isolated during the United Kingdom's most recent major outbreak of equine flu. Clinical signs which may be noted during this viral infection includes number 1. During viral infections, clinical signs in horses includes number 1 sudden onset of the disease, sudden coughing problem, number 2 frequent dry cough, number 3 nasal discharge may be seen, and this discharge may be serous in nature and may also become purulent if opportunist pathogens, mainly streptococcus zooepidemicus, present. And next sign which may be seen during viral infection is fever up to 104 degree Fahrenheit. And next is the variable degree of dullness and anorexia is also noted during viral infections in equines and all other animals as well. Submaxillary lymph nodes may be painful initially but show no obvious swelling in viral infection. In foals, a primary viral pneumonia can also occur. How can we diagnose this viral infection problem in horses? Number one, from history, we can diagnose. Number two, clinical signs will indicate that yes, this is a viral problem. And number three, virus isolation. Confirmatory diagnosis can be done by virus isolation using nasopharyngeal swab as a sample, which must be done early in disease course. This sample, nasopharyngeal swab sample, should be taken in early course of the disease and may be sent to the lab for virus isolation. This will confirm that which virus is present in this disease. Next, diagnosis may be done from serology as well, with paired samples taken in the acute and convalescent phase. In acute phase and in also convalescent phase, blood samples should be taken, and a four-fold rise in HI means heme agglutination inhibition test titer provides confirmation. Four-fold rise in HI titer, heme agglutination inhibition test titer provides confirmation. Next is the differential diagnosis. How can we make differential diagnosis? This is very simple. Other viral or bacterial tract infections should be differentiated from this viral infection by serology, by isolation of the virus from lab, and also through history and clinical signs as well. Treatment. Symptomatic treatment is very good in this case, with good nursing and hygiene as well. When your horse is suffering from viral infection, then we must do symptomatic treatment with good nursing and hygiene. Affected and suspected in contact horses should be isolated if possible. Other horses should be isolated from the infected horses. The virus is shed for 6 days with an incubation period of 5 days. In addition to respiratory disease, the virus causes inflammatory changes in the myocardium and liver. In addition to respiratory disease, the virus causes inflammatory changes in myocardium and liver. It is essential that all work is stopped immediately and that there is a minimum of 1 month's complete rest after the disappearance of respiratory signs. Very important. And this is, I think, not possible in Pakistan, because the persons, the owners, the trainers which are involved in raising the horses, they may not afford to give rest for 1 month to the horses or to the donkeys, to the mules, because they get more work from those animals. And prognosis of respiratory disease. Prognosis is good in uncomplicated cases. If case is uncomplicated, then prognosis is good, where a marked improvement is seen in 1 week, and major secondary problems which may be present, they are: number one, bacterial rhinitis, which is also called as pharyngitis. Number two, bacterial pneumonias. they may also be present. These diseases may also be present in viral infections. And in foals, mortality can be high, in particular with A-equi2 virus, when a primary viral pneumonia is usually fatal within 4 days of the onset of symptoms. Prevention. When we talk about prevention, prevention should be done by isolation. Isolation is the only practical way where horses live in isolated circumstances with few outside contacts. Minimum period of 11 days during which no new cases of influenza are identified should elapse before a yard is considered clear for horses to leave or enter. So prevention should be done by the isolation of the horses, of infected horses, from the other horses and also from any other contact. Number 2, vaccination is another way of prevention of influenza and respiratory problems in horses, in equines. Vaccination is the only means of disease prevention and is currently required under Jockey Club rules. Killed vaccines containing the commonly occurring A-equi1 and A-equi2 antigens, they are used. Killed vaccines are used which contains A-equi1, A-equi2 antigens. They are used for the prevention purpose. This is no cross immunity. There is no cross immunity between subtype 1 and 2. There is no cross immunity between subtype 1 and 2. Vaccines continue to include A-equi1, a strain which no longer appears to be circulating anywhere in the world. So prevention should be done by isolation of the infected horses from the healthy horses, and also prevent the horses from any other contact. Number 2, vaccination. Vaccination is the proper way of getting prevention from respiratory problems. Vaccination against equine influenza must not be regarded as protection against upper respiratory tract viral infection. A flu-like respiratory disease in a vaccinated animal may be due to, number 1, failure of animal to respond to the vaccine. A flu-like respiratory disease in a vaccinated animal may occur due to, number 1, failure of animal to respond to that vaccine. Number 2, another virus which gives rise to similar clinical signs. And number 3, different antigenic types of virus or antigenic drift or shift. These 3 causes may be responsible for respiratory disease problem in vaccinated animals. So this was little bit about the influenza, equine influenza, and respiratory problems which may occur due to viruses in equines, especially in horses. Thank you very much. Jazakallahu khaira.